And now I'd like to introduce our speakers for this evening. Dr. Lori Nuzzi is a director of chiropractic, acupuncture, and therapeutic massage at Valley Hospital. She has a chiropractic experience for over 30 years. She's dedicated to treating musculoskeletal and sports injuries. She uses a holistic approach incorporating various techniques to improve patient well-being. Her focus is not only on providing relief, but also on educating patients about the causes of their issues and preventative care. Dr. Nuzzi's dedication to both treatment and education distinguishes her from others, fostering a healing environment that extends beyond traditional chiropractic care. Daniel Yu is a nationally board-certified acupuncturist and herbalist with 8 years of experience. He integrates Eastern and Western medical approaches to tailor treatments and improve recovery outcomes. Inspired by his own positive experience with acupuncture during graduate studies in biotechnology, Dan specializes in pain management, orthopedics, sports medicine, and various other conditions. His techniques include traditional Korean, Japanese, and Chinese medicine, and he is certified in facial acupuncture. Thank you so much for joining us this evening.
Thank you so much. Thank you for having us. Thank you, George, as well. And I'll start the evening. Well, welcome. We are here to introduce our new department, the Department of Integrative Medicine. Here at Valley Medical Group, we have launched a new department, which includes 3 new service lines: chiropractic care, acupuncture, and clinical massage. And we had the pleasure 3 weeks ago of launching our acupuncture line of service with Daniel Yu as our lead acupuncturist. Here at Valley Medical Group, we believe in integrated approach to pain management, health, and healing, combining modern medicine and the ancient healing arts. We are pleased to present Daniel Yu with Balancing Hormones, and I'll let him take it away.
Thank you, Dr. Nuzzi. Thank you, Parminder, and thank you very much to the Montvale community for allowing me to have this talk today. Daniel Yu. I've been in licensed acupuncture for 8 years. The topic I'm going to talk about today is entitled Harmonize Hormones, Acupuncture Strategies for Fertility and Menstrual Disorders. So the overall presentation outline today is I want to give a little background introduction on traditional Chinese medicine, go into what is acupuncture and how does acupuncture help with the menstrual cycle, and how does acupuncture help with fertility, and we'll finish up with the Q&A. So before diving into about the acupuncture, the big question is, what is traditional Chinese medicine? And traditional Chinese medicine is a medical paradigm or system that was developed 3,500 years ago. And in modern societies, there's a mystique around Chinese medicine. What exactly is it? There's been showcases of it, and sometimes in movies or even TV shows, but nobody really can get an idea of what it is specifically. And to address that, I thought about doing a compare and contrast with modern medicine to give a better idea in detail what it is. So if we do a comparison, a lot of times traditional Chinese medicine looks for the root causes of symptoms, as opposed to more the symptomatic relief. In modern medicine, there's a standardized approach in treating diseases based on clinical trials, the results of clinical trials, which is more of an evidence-based approach. In traditional Chinese medicine, it's individualized. Everybody is unique. You could have the same condition from patient 1 to patient 2, but the presentations may be different. The way it manifests may be different. And because of its long history, the ways that Chinese medicine approaches in the treatment of certain conditions is more experience-based. It's done by trial and error. There is an overall belief that the human body has its own innate healing ability, as opposed to the use of using medications or particularly a lot of procedures. In that respect, there's a push to use natural compounds or herbs or supplements rather than chemical or synthetic ones. In traditional Chinese medicine, there is an emphasis on looking at the whole body rather than the structure or the focus on structures and parts. It's multiple systems working together to give a whole idea of what's going on. while in modern medicine, there's the management, more of a focus on the management disease. In traditional Chinese medicine, is trying to get them out of that particular disease state and looking more toward maintaining health and to make sure those diseases don't come back again. Now, because I'm doing this compare and contrast, doesn't necessarily mean these two paradigms of medicine are always split and apart. There's always room for overlap as well as methods and collaboration. So, with the rich history and evidence and the experience that's gained from traditional Chinese medicine, we could use some of the knowledge from that to help with even developing new clinical research trials on the modern Western side. So, on going deeper into traditional Chinese medicine, what exactly is it? How do they actually think about it? What is the core belief? So, the core belief is that the human body lives in harmony with nature, and everything that occurs in nature, the natural processes, the cycles, the rhythms, all occur within our body. And the aim of traditional Chinese medicine makes sure to balance out these dynamic forces in our bodies. And anytime there's an imbalance, it leads to health issues. Another way to take a look at it is, and looking at the dynamic forces, is this particular symbol. I'm pretty sure people have seen it before. They name it as the yin yang symbol, or it's called the Tai Chi. It's two different forces. So there's a light side and a dark side. And the thing is that it's not static. It's not split evenly down the center. There's always this transition, that movement occurs. And this particular force occurs naturally in our body. The best example I can give is if you think about going and exercising. If your heart rate is 72 beats per minute and you're going to do a good run and increases to, let's say, 120, you want your heart during a cool down period to come very slowly. Otherwise, if there's this sudden drop, then you might experience dizziness or you might even faint. Another example is this expansion and contraction of our lungs. We want it to be a very smooth breathing in and breathing out. Otherwise, it'd be an abrupt and interrupted breathing process, which can cause chest pain or shortness of breath. So these are the kind of forces traditional medicine looks at, and it's a way to kind of view the body as a whole, as well as looking at different systems from a traditional medicine standpoint. So what happens when there is an imbalance? Imbalance leads to a disease state, in which I call tipping the scale. Our bodies are fully capable of taking care of itself. Sometimes we don't even know it's doing that because of that innate healing ability in our bodies. However, every time there's an imbalance and it starts persisting, it builds up over time, you start developing these acute and chronic signs and symptoms that you commonly see. It could be pain syndromes, you get headaches, you could have digestive issues, you won't be able to sleep. So these are the kind of imbalances that a traditional medicine practitioner will look at. When there is an imbalance, because of traditional Chinese medicine's focus on how everything is interconnected in the body, when there is an imbalance in one system, it's not isolated to that system. It actually starts feeding or going into or merging into other systems. So it leads to a domino effect whereby one system can affect another and so on down the line. So when there's an imbalance, what do you usually do? So for patients, they come to see a traditional Chinese medicine practitioner. In ancient China, these were the only physicians around. And how did the ancient practitioners really detect any imbalances? There was no MRI, blood work, or test to give them an idea of internally what's going on. So they decided to build a diagnostic measures, diagnostic pillars. So there are four of them that I would use. One is inspection. So the moment you come into the room, I'm going to be looking at, see if there's, what's the color on your face? Is it pale or is it ashen? Is your gait well formed? Are you walking well? Are you communicating well? Auscultation is listening. If you have a cough, I'm going to be listening to you wheezing. Is there phlegm kind of rattling in your chest? Olfaction is smelling. Is there an odor to like your breath? Is there a strong sweat smell? I'm not going to be a creeper and start sniffing you. It's not like that. It's just a matter of an observation that occurs. Inquiry is Q&As in a way, the questions that I would ask pertaining from a traditional medicine perspective. So if someone comes in, let's say with a headache, where is the headache? Is it in the front, the back, the side, the top? How did it start? What makes it worse? What makes it better? Do you get it? Is it worse when you're stressed? Is it worse when your period starts? So these are the kind of line of questions that I'll ask. And finally is the palpation part, the kind of pushing, prodding, kind of pushing on those muscle groups, see if there's any tension, pushing on acupuncture points, see if there's any tension there or feedback from it. Two of the primary methods of diagnosis is taking your pulse on your wrist and looking at your tongue. So I refer to these as the ancient MRI devices. The pulse itself, there are 3 positions on each hand, each wrist, on the left and on the right. They give you an indication of what's going on with the majority of the organs that we have in our body. So the way you kind of look at it is that that small space on your wrist, it gives a bigger picture of what's going on in the body. In order to verify the findings on the pulses, I also look at your tongue, and the tongue is the mini map of the body as well. So if you look at the tip of the tongue, on that section, it gives you an idea of what's going on with your heart and your lungs. If you go along the sides here, it'll give you an idea about the liver and gallbladder. Toward the middle is more the digestive tract, and toward the back, I'll have an idea of what's going on with your bladder, your intestines, and your kidneys. And then when I look at the tongue, I look at the overall shape, the overall morphology, the color, the moisture, the coating, how thick it is, how thin it is, if there's any coat at all, as well as looking under the veins underneath your tongue to see if they're distended or dark. So once I use those diagnostic measures and get a working diagnosis, what can I offer in terms of treatment to fix these imbalances? So I could start off with cupping as one therapy, which is using pressure on these glass cups on the back on your skin to pull blood to those regions. I could use a technique called gua sha, which is a scraping measure. Tuina is a bone setting. I could prescribe light exercises or even meditations. Massage is recommended. Heat therapy, just to kind of increase blood flow. Moxibustion is a technique to warm the body using an herb called mugwort. I also make dietary and lifestyle modifications. And in particular, I've emphasized a lot on the diet too. A lot of patients have a hard time with certain herbal prescriptions. So the best course or avenue, next best thing is for me to offer dietary advice. Herbal prescriptions, supplements if taken. Liniments are using specific oils and to apply over the body to help with pain syndromes. Poultices and plasters are herbal decoctions that are made into a paste and placed over the skin and wrapped with either a cloth or a bandage. And finally, I could use acupuncture. So what is acupuncture? Acupuncture is part of the modalities in traditional Chinese medicine that involves inserting the needles into your skin or tissues to balance your body's flow of vital energy or qi. And qi is the life force of our body. It's everything that's put together to keep us alive and keep us functioning. And that's what's involved in needling to actually reestablish balance in our bodies. So how's it work? There are over 360 acupuncture points that have been cataloged, and certain family lineages can go up to 700, but they're arranged in these lines that they call channels and meridians, and this is where the qi flows. And like I said before, the imbalances that we get from our everyday lives or diseases, it can cause 3 different states. It can cause congestion, almost like the flow is not there anymore, it's stuck. A deficiency where there's a lack of flow, and or excess where there's too much flow. and acupuncture is used on these acupuncture points to regulate them. So there's another way you could look at it. So I use this garden hose example so for congestion. So if you have a garden in front of you and you want to water your plants, but your garden hose is kinked, there's no water that comes out. So what ends up happening to your garden? Your flowers end up dying. When it comes to if there's too much water, if there's excess flow, that's way too much. It's kind of like a fire hose example. There's way too much water pressure. Again, it could actually put too much pressure on the flowers or to actually dampen them too much, and they could die from that as well. And the opposite is there's too little water. There's a deficiency in the water coming out from your garden hose, so that also affects the quality of your flowers. They might not get enough water to grow. So the plants would die in either one of these examples, and it's a disturbance in the vital flow of water that causes this particular problem, and that's how the acupuncture works in establishing the flow properly. So what are the benefits of acupuncture? In a single treatment, one can actually have multiple things happen. One, you could release natural painkillers in your body, and sometimes the effects of it are very similar to morphine, giving you a lot of pain relief. You could have increased blood perfusion or circulation. You could have a reduction in inflammatory markers in our body, reducing a lot of the inflammation in multiple systems. You can have a switch from a fight or flight response to a rest and relaxation and digestion response, promoting the sense of well-being and relaxation. And all in all, together, they can help with orthopedic problems, especially with range of motion issues. It can help with stress and anxiety, help reduce some of the allergies, especially allergies in season right now, promote a sense of well-being, as well as increase immune function. So going into the topic for today, look into the menstrual cycle, and this is more of the modern medicine take on it. If you look on the left graphic, you'll see that the cycle itself is split into two large phases. They call it the follicular phase and the luteal phase, and it's split between 14 days in the first part and the next 14 days in the next. The first follicular phase is pretty much estrogen dominant, and the luteal phase is more progesterone dominant. In the center is your ovulation mark, and this is where the luteinizing hormone is spiked to actually release the egg. At the very early set of the follicular phase is your period or the menstrual flow, and that occurs in the follicular part of the cycle. The graphic on the right explains almost like a more simplified view of how things work with the menstrual cycle. It's this axis that occurs from how there's a feedback system with your hormones, as well as how your nerves work and the neurotransmitters from our brain. It goes from the hypothalamus, from the brain, from the pituitary gland, which is a master gland of hormones, then it influences the ovary and the uterus, and there's a feedback from the ovary to uterus back to the pituitary, back to the hypothalamus, and so on. So this is another way to kind of look at the menstrual cycle. If you look on the right, that's more the modern medicine take, it more in a circular diagram. You have the split again with the follicular phase, and on the right, and the luteal phase on the left, ovulation in the center, and the menstrual cycle, that's a menstrual period on the right side, on the upper right side. Chinese medicine takes a little different view on this. If you look on the left, you're seeing the yin-yang symbol again. And now it's split into 4 phases. And each of these phases are, they have treatment principles of what to do during those particular parts of the phases. You have to look at the menstrual cycle as like the 4 seasons. And the goal of the menstrual cycle, like especially from traditional Chinese medicine, is to balance out these phases and make sure there's a very smooth transition that occurs. Anytime there's an imbalance, then fertility issues can arise, or menstrual disorders can arise from this. So going deeper into it, when we start off with the menstrual phase or the actual period, this is the winter part of the season of the menstrual cycle. And by this, I mean, if you think about how with the menstrual period, there is a shedding of the lining, um, there is a promotion of blood to move blood out to set up for the next cycle. You think about how winter toward the new year, when we are shedding all the stuff that happened in the old year in order to prepare for the new, that's the kind of process that a traditional medicine practitioner would think. The treatment principle would be to move the qi, move the blood to ensure that the lining is completely shed to actually set up for the next phase. In the next phase in modern medicine, there's a follicle stimulating hormone that stimulates the ovaries to produce follicles, each with an egg. At the end of it, you have a dominant egg, and that releases estrogen to make sure that the lining starts thickening up. This is the springtime. The follicular phase is the springtime in Chinese medicine, and this is more of the building phase, very latent. You're slowly kind of building things back up again, and that's representative of spring. And the principle behind this is making sure there's support for blood and tissues for the lining of the uterus. So the ovulation phase is the summertime, the apex of the cycle. The rise in estrogen levels increases the luteinized hormone to actually release the egg finally. And then the egg travels down the fallopian tubes, the ducts, in with the hope to get fertilized by the egg if there's sperm available. And it's a switch from like the building phase to more of this vibrant energy. And the principle behind it, again, is to move qi and blood, not to actually shed the lining, but more so to make sure that the egg is uninhibited when it's going down the fallopian tube, as well as supporting our body to make sure it's as strong as possible. The luteal phase is the fall season where things kind of wind down a little bit. It's not that summer beach time anymore. You're kind of in the harvesting mode, kind of settling in, things a little bit more quiet in preparation for the winter. Now, there's two ways that this can go. So if the woman gets pregnant, there's a production of HCG, which helps with maintain the pregnancy, as well as maintain the lining of the uterus. But if there is no pregnancy, then the hormones, the estrogen and progesterone, rapidly decrease in preparation for the period. And at this phase, like I said, there's two ways that can go. If the woman ends up being pregnant, there's a lot more support for the vitality and energy. Otherwise, I'll be employing more of a movement to ensure that the period is very smooth and during that time comfortable. So in terms of like the diagnosis for menstrual disorders, when I have a patient who's coming in with menstrual problems, I go through the diagnostic measures and the inquiries as I explained before, but there is a lot of focus on the cycle as well as the period. And with the examination, I'm asking questions about, is your cycle regular? Is there any changes to the blood? What color is it? How thick is it? Is there any associated symptoms like back pain, breast tenderness? Are you moody? These are the kind of things I will be asking for. The other stuff that I look into is whether or not you're stressed. What kind of diet do you have? How much exercise are you getting? How much medication are you taking? Are there underlying medical conditions, as well as their family history? And give me a sense of like what's going on. The graphic I'm showing is actually what happens with the period blood. There could be various colors to the period blood. There could be various textures to it, as well as clots, but each of them would give me an idea of a particular pattern or diagnosis in Chinese medicine and kind of navigates me toward how I should go about treating the patient. So when it comes to the treatment, it's really based on the diagnosis and the patterns that emerge. When a patient gets treatment for a menstrual disorder, it can actually induce a new cycle. And it's this focus on setting up a new cycle to ensure that the hormones themselves indirectly are balanced out. Uh, and it may take quite a few cycles before like you see some changes, but some patients can be quite sensitive and they could actually experience it in a single cycle. When it comes to Chinese medicine and fertility, the period in the cycle is as a precondition for fertility. The cycle has to be there has to be a rhythm to it. There has to be a very strict routine. What I'm looking for in terms of a cycle for a patient is I want the period to be about 3 to 4 days, cycle to be 28, and consistently 28 to 30 days. The period should start and stop. There's no spotting, there's no pain, there's no clots. I don't even want to see any PMS symptoms. That's the kind of parameters I strive for to help ensure that there's a higher probability that a patient could succeed in getting pregnant. Now, the way I look at it is that the environment has to be right. So it's this guest host uh, uh, analogy. When you think about having a baby, you think about having a guest within you. And when you're prepping for a guest to be with you for 9 months, you think about what goes into it. There's a lot of preparation that goes into it, making sure, for one, that your home is not too cold, not too hot. Is there enough food? Is it comfortable? Is the bedding comfortable? Things like that are the kind of thought processes that occur even with making sure your guest is comfortable. And a lot of time, and it takes two to tango. A lot of my female patients who want to get pregnant, I ask their partners to also come in to get treatment, because even in instances, let's say for IVF or IUI, you want the sperm quality to be great, you want sperm numbers to be increased, you also want to make sure they're healthy, and in order to increase the probabilities of getting pregnant. So what can acupuncture treat? The World Health Organization wrote out what it can do for OBGYN patients, and it can help with a lot of different issues during pregnancy, afterwards, such as with labor pain, malposition of the fetus, morning sickness. Female ureter syndrome is more like it's issues related with urination problems. Hypoovarianism can be a lack of functioning of the ovaries. Even lactation issues after birth, polycystic ovarian syndrome, and premenstrual syndromes. This is not a complete list. It's not an exhaustive list because acupuncturists like myself and other acupuncturists over the years have treated for various menstrual conditions and conditions for menopause as well as perimenopause symptoms. And some of the conditions may be related to what you may be experiencing. So menstrual cramps, irregular periods, uterine fibroids, endometriosis, amenorrhea, during pregnancy, back pain, the brain fog, fatigue, postpartum issues like mood swings, urinary incontinence, pelvic pain, perimenopause and menopause symptoms like hot flashes, night sweats, libido issues, headaches and migraines, poor sleep, insomnia, and even like skin and hair changes. Acupuncture and traditional Chinese medicine helpful for. So before we wrap it up, I want to actually go through some common questions that patients often ask me. So does insurance usually cover for acupuncture treatments? A lot of the major insurance companies do. The best approach is to make sure, like, to call in to get your benefits verified. But if you don't have any coverage, you don't have any insurance, we do have very competitive cash rates for these services. It would be $140 for the initial visit, and the follow-up visits are $65. Would you need a prescription or a referral? Not necessarily. Through Valley, a lot of the physicians have been referring. I'm very grateful for it. But to get an acupuncture, you don't need these. And do the needles hurt? Barely. I use these needles on my young children. They don't feel anything. That's why they allow me to treat them. The needles are hair fiber thin. And a lot of times when patients, once they get the needles and they're laying on the treatment table, they relax or they take a nap. And how long is a single treatment? The initial treatments will be 60 minutes for the first treatment, and the follow-ups are between the 30-40 minutes. And how many treatments will it take to help my condition? That really depends on the condition. I usually look for a very robust treatment schedule within the first month. And as your condition gets better, I start tapering down on the treatments. So thank you very much for joining me today on this presentation. As a thank you to everyone here, integrated medicine is allowing for 15-minute complimentary consultations. And you call and schedule in at the number below in case you want to talk to me specifically about a condition that you want to get treatment for. And I'm hoping I could point you in the right direction or have you come in for a treatment. Thank you.
Thank you so much, Daniel. That was very informative. We do have some questions. Everyone at home, if you do have any more questions, please send them in now, and we can go through the questions. So the first question, how can acupuncture alleviate PMS symptoms?
So it's really focused on regulating your cycle. It's an indirect way of tackling the hormone issues that are associated with it by making sure and striving for what I call like the perfect cycle, where I was outlining the number of days for the period as well as the cycle itself and some regularity to it. It helps with reducing a lot of the PMS symptoms. Now, every individual is different. There could be other factors that could also be driving it. Some women would have PMS symptoms because of poor dietary choices. And that's a conversation I'll have with that patient to make sure to avoid those or find alternates for it. And then once those are addressed, see what happens in the next cycle. Are the PMS symptoms reduced? Are there no PMS symptoms? Or let's say the breast tenderness that was very severe is more milder now. So that's the kind of approach I take when addressing the PMS.
Great, thank you.
Mm-hmm.
PCOS symptoms are so vast. What symptom relief is practical with acupuncture?
A lot of times with PCOS, a lot of patients come in with a lot more pain, like lower abdominal discomfort. I had an interesting case where a woman came in because she had PCOS, and what I ended up finding out was that there was a dietary association with it. So we were trying to figure out exactly what she was eating that was almost aggravating her symptoms, and later found out there was a lot of like dairy as well as certain foods that she was eating. And she was very militant about addressing this. So she actually cut out the very things that she was sensitive and allergic to in her diet and actually got rid of her PCOS. So again, that dietary component could be there. Acupuncture helps with also increasing blood flow to the ovaries and the uterus. So in the manner of like increasing blood flow to make sure things are flowing right, as well as releasing a lot of those natural painkillers in our body. It helps address a lot of the symptoms of PCOS.
Can you just explain what PCOS stands for, just so the folks at home, in case somebody else
Oh,
is
polycystic ovarian syndrome is where like the cysts are growing in the ovaries. It's almost like they look like kind of grape clusters over the ovaries.
Great, thank you so much.
Mm-hmm.
Are there any risks from having acupuncture?
Very minimal. So because I'm still using a needle, there is always a risk for bruising, but very few risk factors like that. And a lot of times when patients do end up with bruises, they don't really feel it just because of how thin the needles are. And those are the biggest like risk factors for it.
Okay, thank you. And how long do the benefits of acupuncture last?
It really depends on the patient. On average, when they come in, I have patients feel the treatment effects for about 2 to 3 days. Some who respond very well actually can get rid of like their pain syndromes on that first treatment and never see that again. So it really varies from patient to patient.
Okay, and then so the question is, what about treatment for menopause? What would be the treatment for menopause?
Menopause treatments, it really depends on what kind of symptoms you're coming with. Acupuncture will always could be utilized, but I also like look into the diet as well as what you're eating. So I had a patient recently, she was taking a supplement for joint pain, but the herbs within that the the supplement that she was taking were actually causing to have more hot flashes. So I recommended her to stop that particular supplement. So dietary is one, acupuncture is another, and possibly other supplements as well as even a possible herbal prescription to help manage the symptoms.
Great, thank you. I've heard you shouldn't shower after having an acupuncture session. Is that true, and why is that?
I'm sorry, with shower?
A shower?
That may be more so with cupping. I've not really with acupuncture, more so with cupping. It's because when during a cupping session, because you're kind of pulling the blood into those concentrated areas and your pores are opening up, what ends up happening in Chinese medicine when you take a shower, it introduces something called cold and leads to more contractures or tightness in those areas and leads to more problems down the road. So think of it as like because your pores are open and now that you're exposed to wind draft showers, everything tightens up again. So the very treatment that's supposed to relax you afterwards, because with shower, it tightens things up quickly. So that's why there's a, a recommendation not to have a shower after a cupping session. But I never heard of one for acupuncture.
Okay, thank you for clarifying that.
Mhm.
And then when should acupuncture be avoided? Are there any certain times that a person shouldn't, see an acupuncturist to have a session?
Usually, like, not really. There's no really like those kind of contraindications, but the recommendation that I have is like when you come for an acupuncture session, eat something. The reason is because it takes energy to move energy. So if you're depleted, what may end up happening is that you feel a little woozy afterwards, and that's just to kind of avoid those kind of problems with the treatment. But if there's say, yeah, there's not really that much contraindications in that sense.
Great, thank you.
Mhm.
I don't see any more questions coming in. So, thank you so much, Daniel, for your very informative presentation this evening.